Public Health Initiative Media. The object of this TV screencast is to provide education on two current health concerns in our community: meningococcal disease and salmonella. Meningococcal disease is caused by a bacterium. Many people carry this bacteria in their nose and throat but never get sick. Meningococcal disease can affect the bloodstream or brain and spinal cord. Sometimes it affects both the brain and the bloodstream. Each year in the United States, about 1,000 people get meningococcal disease. The greatest risk are to individuals between the ages of 15 and 21. College students, especially first-year students who live in dorms, military recruits, and prisoners are at an increased risk for meningococcal disease. It is easy for infections to spread in crowded dorms or enclosed areas where students and other people often meet to smoke and drink alcohol. Some of the symptoms of meningococcal disease are fever, a flat pink to red purple rash, nausea, vomiting, general muscle aches, sudden severe headaches, confusion, and sensitivity to light. The symptoms of meningococcal disease may often be mistaken for less serious illnesses such as the flu. It's important to get meningococcal treatment right away. If left untreated, infection can be fatal. Because this infection spreads to others in close contact, all of those who have been in contact with someone diagnosed should contact their doctor. If you are a student about to start college, here are some health tips. Reduce your risk of getting meningitis by reducing your exposure to smoking, drinking alcohol, excessive stress, and upper respiratory tract infections. Strengthen your immune system by living a healthy lifestyle that includes enough sleep, exercise, and a balanced diet. Avoid sharing eating utensils or drinking glasses. Cover your mouth when you cough or sneeze, and, as always, wash your hands. Get familiar with your college student health services, find out who to call or where to go if you get sick, and remember that your doctor or pediatrician is always available to answer any questions you may have. If you need more information, feel free to contact www.nfid.org/meningococcal to learn more about vaccines and how to prevent meningococcal disease. Another illness we will discuss is foodborne illness. Salmonella is a common bacterial disease that often infects the intestinal tract. Humans can become infected most frequently through contaminated water or food. Typically, people with salmonella infection have no symptoms. Others develop diarrhea, cramps, and abdominal cramps within 8 to 72 hours. Most healthy people recover within a few days without specific treatment. Some common symptoms of salmonella are nausea, vomiting, abdominal cramps, diarrhea, fever, chills, headache, and blood in the stools. The geographical location of salmonella is through widely distributed bacteria found in domestic and wild animals. They are prevalent in food animals such as poultry, pigs, and cattle, and in pets, including cats, dogs, birds, and reptiles such as turtles. Salmonella can pass through the entire food chain from animal feed all the way to households or food service establishments and institutions. Salmonella is found globally worldwide and is most generally contracted through the consumption of contaminated food of an animal origin, mainly eggs, meat, poultry, and milk, although other foods, including green vegetables contaminated by manure, have been implicated in its transmission. Salmonella bacteria lives in the intestines of people. Most people are infected with salmonella by eating foods that have been contaminated by feces. Commonly affected foods include raw meat, raw eggs, fruits, and vegetables. Individuals with compromised immune systems, the elderly, and children are especially vulnerable to contracting salmonella. Salmonella infection can be detected by testing a sample of stool. However, most people recover from their symptoms by the time their test results return. Salmonella infection can be dehydrating, and treatment focuses on replacing fluids and electrolytes. In addition, your doctor may recommend medications to help relieve cramping And if your doctor suspects that Salmonella may have entered your bloodstream, or if you have a severe case or a compromised immune system, he or she may prescribe antibiotics to kill the bacteria. Ways to prevent Salmonella is wash your hands. Use after using the toilet, changing a diaper, handling raw meat or poultry, cleaning up pet feces, and touching reptiles or birds. For more information, contact the United States Department of Health and Human Services at foodsafety.gov or visit your local health department's website.